Good afternoon. I'm Sarah McKetta. I'm an epidemiology MD PhD candidate at Columbia University's Mailman School of Public Health. Thank you so much for inviting me to speak today. I'm going to be walking you through our recent work in progress in which we examined trends in alcohol consumption frequency during the first wave of the COVID pandemic in the United States. My co-authors are Drs. Christopher Morrison and Catherine Keyes. So community spread of SARS-CoV-2, which, as you know, is the virus that causes COVID-19, led to unprecedented disturbances in the day-to-day lives of US residents. Millions were directly impacted by health concerns related to the virus, and millions more experienced school and daycare closures, job loss, economic insecurity, and stay-at-home orders restricting typical movement, consumption, and social routines, particularly during the first wave of the pandemic. It's likely that alcohol consumption patterns have also changed. So these types of financial, social, and family stressors increase the risk for alcohol consumption. But the disruption of social opportunities for consumption, like bars were closed, restaurants were closed, people couldn't have parties, those things may have actually decreased alcohol consumption. So very briefly, alcohol consumption is a leading cause of death and disability, both globally and locally in the United States. Even at low levels of consumption, alcohol is associated with adverse health outcomes. Alcohol as a form of coping is considered maladaptive as it increases the risk for depression and subsequent substance use disorders. Regarding physical health outcomes, short-term acute increases in alcohol consumption increase the risks of injury and poisoning. Now that the epidemic has persisted into late 2020 and vaccines are still quite a ways away, we may need to start worrying about the more chronic harms of alcohol consumption, like heart disease, metabolic diseases, liver diseases, and cancers. So what do we already know? Evidence from other countries, and particularly Poland, suggests that the pandemic did influence alcohol consumption. But the changes were sometimes inconsistent. So in the Poland example, some people increased consumption and others decreased consumption. The US saw an increase in alcohol sales, but it's not totally clear if that perfectly translates to consumption, especially given pandemic overpurchasing for fear of shortages, especially with something was happening in the first wave. So limited research on self-reported alcohol consumption in the United States during this time period, it does suggest that alcohol consumption did increase as a result of the pandemic. So compared to the spring of 2019, adults in May and June of 2020, on average reported greater frequencies of past month alcohol consumption. This was particularly pronounced among respondents who felt highly anxious and who reported fear related to COVID-19. Also, solitary drinking increased. More people were drinking alone. Finally, many states changed their alcohol policies during this time. I'm sorry, I have a noisy cat. A lot of these policies, the changes allowed for things like takeaway drinks, home delivery, and online ordering. State policies influence alcohol consumption behaviors, and there may have been variation in US state by alcohol consumption during this time. Drinking behaviors and state policy were both responsive to the actual COVID-19 burden, so we may expect to see variation in alcohol consumption both geographically and according to state level disease burden. So our research question, to better understand alcohol consumption behaviors during the first wave of COVID-19 pandemic, we measured trends in alcohol consumption frequency and heterogeneity according to both the US state and state COVID-19 burden during this first wave of the pandemic. You're all familiar with the study protocols, but we did use the Understanding America study as our main data source. We looked at waves 1 through 5 of the COVID surveys, which included 6,172 unique participants and 28,000 or so observations. Our outcome was alcohol frequency, which was operationalized as the number of drinking days over the past 7 days. So that was a count which we modeled from 0 to 7. We modeled trends over time using 3-level growth models, which controlled for these individual covariates shown here. And we had random slopes for states and random intercepts for individual respondents. We also examined heterogeneity by COVID-19 burden, which we defined as whether or not the state had the median national cumulative incidence of cases at survey time. So these data were made available by USA Facts, and we used the median cumulative incidence threshold to dichotomize states as high or low COVID-19 burden by calendar day during the survey. What we found was that, in general, alcohol consumption frequency did increase. So the marginal increase is shown here. At the beginning of the study period, respondents, on average, reported about 1.3 drinking days. By the end of the study period, respondents, on average, reported 1.65 drinking days. But we observed heterogeneity by state-level COVID-19 case burden. So that's shown at the bottom half of this slide now. At the beginning of the observation period, respondents living in states with higher cumulative incidence of COVID-19 cases had a predicted 1.5 or so drinking days per week. That's this line in blue. Whereas those in states with lower COVID-19 presence had a predicted 1.2 drinking days. But by the end of the study period, respondents living in states with higher COVID-19 presence, again, the blue line, had about the same amount of predicted drinking days. So it went from 1.5 to 1.4, but it was a non-statistically significant decrease. Whereas those living in states with fewer than the median cases, so the lower COVID-19 burden, experienced increases in drinking days, going from a predicted, 1.2 to 2.05 drinking days per week. I'm not going to show the state level, individual state level slopes, but there wasn't a lot of heterogeneity across US states once we controlled for the COVID-19 burden. So generally what we concluded is that alcohol consumption frequency did increase, but these increases were concentrated in states with a lower COVID-19 burden. And obviously this is a descriptive paper, so we aren't positioned to make causal claims, but these findings can help us to investigate hypotheses about the drivers of these trends. And in combination with the limited heterogeneity across individual states, this suggests disease burden really matters the most here, and it might be related to broader categories of maybe policy changes or reduced consumption in bars and restaurants in states with higher disease burden. And I realize I'm out of time, so just a major take-home message is that we need to be remembering to screen not just for COVID-19 systems, but for risky health behaviors as well. Alcohol consumption is a really normalized behavior, but it's a major contributor to morbidity and mortality. And care providers, policymakers also remember to remain mindful that focusing resources on the current epidemic must not come at the expense of screening and management of other health risks. Thank you so much for your time and attention. I'm looking forward to hearing your thoughts and questions about this.